Okay, so today we're doing a DSM-5 case formulation on KAngel from Needy Streamer Overload. This is a normal psychology instructor lecture. I'll be giving you some insight into the DSM-5 diagnostic criteria and what I believe KAngel's DSM-5 diagnoses are based off of personal experience using the DSM-5 to diagnose. So this is a fictional character analysis for educational purposes only. This is not a clinical diagnosis of KAngel. But this does use a DSM-5 TR framework applied for conceptual learning. So her presenting features are online validation dependency, mood shifts tied to engagement metrics, identity diffusion, maladaptive coping under stress, mainly with drug abuse and self-harm, fear of abandonment, and persona versus private self split. She has features of borderline personality disorder, which includes the fear of abandonment, identity disturbance, affective instability, impulsivity under stress, and self-destructive tendencies. She self-harms and does have a history of drug abuse. Therefore, she meets the DSM-5 criteria for borderline personality disorder. She also meets the DSM-5 criteria for dependent personality disorder. Her features in this include excessive reliance on others for validation, especially her boyfriend P-chan, difficulty making independent decisions. She normally makes P-chan make all the decisions for her. She has fear of being alone or unseen, and she has submissive attachment behaviors, all of which point towards a DSM-5 diagnosis of dependent personality disorder. She has major depressive disorder features, which include low self-worth beneath her persona, hopelessness when validation declines, emotional withdrawal, and cognitive distortions, which are worthlessness. These all meet the DSM-5 criteria for major depressive disorder or a depressive episode under the DSM-5 criteria. She also has digital reinforcement dependence, which is a DSM-5 diagnosis. She is dopamine driven on validation cycles. She she uses likes or views as an emotional regulation. She has compulsive engagement seeking, and she has a behavioral addiction framework to digital reinforcement. Therefore, she meets the DSM-5 criteria for digital reinforcement dependence also. She also has an identity fragmentation disorder, which is recognized by the DSM-5. She has the following features of that: KAngel versus a private self split, Amy Chan. She has a externalized identity formation. She has emotional outsourcing to the audience, and she has a digital identity diffusion. These all support the diagnosis of identity fragmentation disorder as stated in DSM-5. There are some other considerations, possible diagnoses that are not clinically supported, but could be clinically supported given more context. She could be on the bipolar spectrum. This is not clearly supported, but she does have manic features, which could support a bipolar 1 diagnosis. She could have PTSD or trauma-related disorders. We do not know her backstory too well to know about this. She could have autism spectrum traits. She is context dependent, meaning she does have some autism spectrum traits, but she does not meet the criteria for a diagnosis of autism spectrum disorder. She also could have substance-induced mood disorder, as she is commonly using substances to cope with her emotions. These can induce mood disorders, and because of that, we could also conclude that she has substance-induced mood disorders from substance abuse. The clinical formulation here is that she has severe identity instability reinforced by digital validation systems. With borderline plus dependent traits and depressive cognition, she has a behavioral addiction loop that maintains her symptoms. So KAngel illustrates modern identity formation issues when self-worth and stability are outsourced to feedback systems. Thank you for listening to this little lecture. I hope it's been kind of fun and kind of engaging to give you a view of abnormal psychology. And I hope to see you again soon.